There are 4 different locations for your intramuscular injections, and I'm going to go ahead and show you all 4 of those. The first one we're going to do is the ventrogluteal site, and to reach this site, I'm going to place my hand on the greater trochanter, point my index finger to the superior the anterior superior iliac spine. When I do that, my finger should be pointing towards the belly button. And then I'm going to take my middle finger and point it towards the iliac crest. And my injection site is going to fall right between those 2 fingers, so right there. And that's the ventrogluteal site. All right, the next site we're going to do is the dorsogluteal site. And to landmark this site, the first thing I'm going to do is have my patient lay on their side and flex their knee. I'm going to locate the greater trochanter as well as the posterior iliac spine, and I'm going to draw an imaginary line there. And my site is in the center of the top line. So I've drawn my imaginary line this way, and when I drew that imaginary line, I kind of made a little triangle, and it's going to be in the middle of that top, middle of the top, as well as the middle of this line. So my site would be right here. The next site we're going to landmark is the vastus lateralis. To landmark the site, what I'm going to do is put my hand on the greater trochanter and one on the lateral femur condyle, divide this into thirds, and then I'm going to divide it into thirds again. 1, 2, 3, and my site is the outer third. The final one we're going to landmark today is the deltoid site, and we're actually going to go ahead and give our IM injection with this. In order to landmark this site, what I'm going to do is I'm going to find that acromion process and draw my triangle down. And there's my location. The next thing I'm going to do is clean that site. I'm going to use a circular motion, starting from the inside out. And I'm just going to leave this here, pointing to my spot that I'm going to inject, like so. While that alcohol dries, what I'm going to do is go ahead and put on my gloves. Verified my dose already. Checked my 5 rights. This is Brett. I'm going to uncap my needle. I'm going to stabilize my injection site and stabilize my hand as well. I'm going to hold the skin tight, and then I'm going to inject at a 90-degree angle in a dart-like motion. Stabilize, aspirate. If there's no blood return, I'm going to go ahead and inject at a slow, steady pace. Pull my needle out at the same direction that I inserted it. Apply my safety. If I needed to, I can put some pressure if there's some bleeding, and apply my Band-Aid if necessary. Like so. I'm going to dispose of my sharps in the sharps container.